Assalamualaikum warahmatullahi wabarakatuh. Let me introduce myself. My name is Rona Risty. I am medical student of University of Islam Agung Semarang. So in this occasion, I will talk to you guys about heart attack signs. The topic that I will talk about is very important to add insight to the general public, to my audience, to general public like all of you. Because heart attack itself is the number one killer in the world, especially in Indonesia, where this heart attack occurs suddenly, so many humans cannot handle it. And I'm here to present to you guys about heart attack signs, the definition, the symptoms, the factors, and how to prevent it, so that we all can not have heart attack and health always healthy. So let's just start it. Okay, so the ideas are the definition of heart attack, the causes of heart attack signs, and how to prevent heart attack. Okay, so the first one is a heart attack definition itself. A heart attack, or as we know, or in the terminology medical, is known as myocardial infarction or MI, is a serious medical emergency in which the supply of blood to the heart is suddenly blocked, usually by a blood clot. And then the causes of heart attack. A heart attack occurs when one or more of your coronary arteries, which is the arteries that supply our heart, becomes blocked. Over time, a buildup of fatty deposits, including cholesterol, from substance called plaque, which can narrow the arteries, and it's called as atherosclerosis. This condition called coronary artery disease that causes the most of heart attack. So as you can see, this is the blood vessels that blocked by blood clot, and then this is plaque, and this is the coronary artery. Okay. Next, during a heart attack, a plaque can rupture and spill cholesterol and other substances into the bloodstream. A blood clot forms at the site of the rupture. If the clot is large, the size is large, it can block the blood flow through the coronary artery, which means it will starve the heart of oxygen and nutrients, which we can call it ischemia in medical terminology. Another cause of heart attack is a spasm of a coronary artery that shuts down blood flow to part of the heart muscle. Using tobacco and illicit drugs such as cocaine can cause a life-threatening spasm. And the other one, infection with COVID-19 also may damage your heart in ways that result in a heart attack. Okay, and this is our main topic, heart attack signs. Signs and symptoms of heart attack are shortness of breath, chest pain, nausea or vomiting, anxiety, sweating, and dizziness. So many, right? And the common signs and symptoms include pressure, tightness, pain, or a squeezing or itching sensation in your chest or arms that may spread to your neck, jaw, or back. Again, shortness of breath, nausea, indigestion, heartburn, or abdominal pain, or pain that in your stomach, on your stomach, uh, on your abdominal part. And then cold sweat, fatigue, lightheadedness, or sudden dizziness. Okay, heart attack symptoms, so many, right? I've told you that there is so many heart attacks, but not all people who have heart attacks have the same symptoms or have the same severity of symptoms. This is, you have to take a look that not all people who have heart attacks have the same symptoms. Some people have mild pain, others have more severe pain. Some people even have no symptoms at all. For others, the first sign might be sudden cardiac arrest. However, the more signs and symptoms you have, so the greater the chance you are having a heart attack. Some heart attacks strike suddenly, but many people have warning signs and symptoms hours, days, or weeks in advance. The earliest warning might be recurrent chest pain or pressure or angina. We call it angina in medical terminology. That's triggered by activity and relieved by rest. So it triggered by activity and it relieved by rest, like you're sleeping and then the next day you feel okay. Angina is caused by a temporary decrease in blood flow to the heart. And then the last topic is how to prevent the heart attack itself. So the first is medication. Taking medication can reduce your risk of a subsequent heart attacks and help your damaged heart function better. Continue to take what your doctor prescribes. So the first step is you have to go to the doctors, you have to consult about your health, and then you continue to take what your doctor prescribed and ask your doctor how often you need to be monitored or how often you have to visit your doctor. And the last is the most important is our lifestyle factors. You know the drill. Maintain a healthy weight with a healthy diet, don't smoke, exercise regularly, manage your stress, don't think too much, okay? And control conditions that can lead to a heart attack, such as high blood pressure, high cholesterol, and diabetes. Okay, that's all I can say for the conclusion of for the summarize is all I can say is so a heart attack is a disease that caused due to blockage of the blood vessels that provide nutrient to the heart, which is the coronary artery. The signs of heart attack, it can be vary, but cannot be the same in every human being. The most important thing you can do to prevent the heart attack is to maintain a healthy lifestyle. So that's all I can say. Thank you for your attention. I hope my presentation, this occasion will have good to you. You will know further about heart attack so that we all can prevent it. Okay. That's all I can say. Thank you for your attention. Assalamualaikum warahmatullahi wabarakatuh.